Okay, I want to talk about the coning or doming that you might see in your abdomen when you do ab exercises, planks, crunches, sit-ups, or even maybe you see it as you get up from off the couch or get up from out of bed. You see that coning right through the midline of your abdomen. So let's talk some anatomy first. So right through your midline, you have your linea alba. It connects your rectus abdominis together. So those are your outer core muscles, and they, it's like your six-pack muscle. Underneath that, you have your external and internal obliques, and then under that, you have your TVA, which is your transverse abdominis or corset muscle. Let me grab my ball. So, we're going to be talking about your deep core muscles. So those are your diaphragm, which is up here, and your TVA wraps around here through your midline, and then your pelvic floor is at the bottom. So let's think of our deep core. So we have this canister full of some sort of pressure, we'll say air, and we want it to be regulated. We want it to be an even amount throughout the whole canister. So if we're thinking of our muscles, let's say our pelvic floor is underactive, and our diaphragm and our TVA are doing fine. They're putting in a lot of work. Maybe they're overactive. You don't know. But there's nothing here holding in all the pressure. So you're going to have a nice squeeze here and a squeeze up top, and there's a bunch of pressure that comes down onto your pelvic floor, and that is going to cause it can cause incontinence, peeing or leaking when you run or jump. It can cause, because all the other muscles, hip flexors, lower back muscles are working in overdrive, so you might feel a lot of pain from that. And then let's say, what if could be the same thing. What if our pelvic floor and maybe our diaphragm is working okay, but our TVA is not? So then we have nothing to regulate this pressure here. And so when you have your diaphragm's working in overdrive, your pelvic floor is working in overdrive, you get a lot of pressure outward, which can cause put a lot of pressure on your linea alba, which can cause the diastasis recti, hernias, and other things like that, back pain as well, because there's nothing to support that pressure to keep it in and regulated. So how do we regulate that pressure to prevent all of these common symptoms from happening? Can you guess it? It's from the core breathing belly pump. So it's super important to use this and integrate it into your life, daily life, exercising, whatever you want to do. I encourage my clients to do it all day, every day, while you're walking, while you're bending down to pick up your kids, when you're picking up groceries, picking up the car seat, and then of course when you're exercising, to protect your core, to regulate that internal pressure, so that you can live a life without pain and without incontinence,